It's such a sad, sad loss that the legacy of this Maha movement will be that it was a scam.
Mhm.
It's all a scam. And it's so sad that so many people have been so easily wrangled into this farce.
Hey there, fellow nerds. Welcome to another episode of The Present Illness, the podcast where two physicians try to make sense of a world that's a little febrile and definitely underdiagnosed. I'm Argavon Salles, a surgeon scientist and your friendly neighborhood doom scroller in residence.
And I'm Alyssa Burgart, an anesthesiologist and bioethicist who tracks news and health law like their EKGs, full of spikes and surprises. The Present Illness is where we dig into public health, politics, culture, and ethics with a scalpel in one hand and a meme in the other.
Thanks to everyone who's listened and is tuning in now. Extra love to anyone who follows or subscribes to our podcast. And a warm welcome to anyone who just stumbled in from your tryptophan hangover from Thanksgiving. Try saying that 3 times fast.
Well, we're glad you're here. Let's get into it.
Okay, what I want to talk about today has to
Okay.
do with one of our favorite people, RFK Jr. And yeah, the look on your face. And some updates on what's happened in public health over the recent little period here. So, part of why I thought we could talk about this is this past weekend, there were two kind of major pieces that came out in which RFK Jr. plays a role. So, one is a lengthy profile of him that came out in The Atlantic. And in fact, he is on the cover of The Atlantic in a
Oh,
photo.
gross.
Yeah, and I think our listeners are just gonna have to check out that photo for themselves to really, like, get
The
the
one with
gist of
is
it.
it the one with the rosary?
Yeah, the one with the rosary, wherein they say I should have pulled it up, but they say something like he's the most important man in science or something right now. I don't know if you have it in front of you, but
I mean, did they mean infamous? Did they is it a misprint? I think they meant infamous. They should really talk to their copy editor.
I know, right? One of the reporters on Twitter I saw was defending it, saying like, "Well, how can you argue that this man" I mean, I think if they use maybe influential, that's the thing, like, he has power, obviously, in his position, but
So much
anyway.
power.
He's on the cover for this article, and, clearly, the writer of the article spent a lot of time with RFK Jr., and he references multiple different events that he went to. Anyway, so that's one article, is this long profile that I wanna talk about, and there's an article that his cousin, RFK Jr.'s cousin, Tatiana Schlossberg, published in The New Yorker that is really about her and her health issues, but in multiple places also is pretty clear about how she and her family, her immediate family, view what RFK Jr. is doing to public health and science. And it's not favorable, just to be clear. Um, and we now have just this week the appointment of a new deputy director at the CDC who is meant to be the second in command at the CDC, but we don't have a director currently, right? Because Susan Menarez was forced to resign. And so this is, even though he's supposed to be second in command, this is now like really the highest current ranking person at CDC aside from, RFK Jr. himself. Um, and so I want to talk about that person and how that person and their views and their experiences relates to all of this stuff. So I think let's start with the Atlantic article. So basically, the author, again, does this long profile. He mentions a couple different places in the article that RFK Jr., you kind of didn't want to do this in the first place because he feels like he's so maligned in all the articles that are written about him, and he didn't want to just sign up
He
for
he
another.
didn't wanna be interviewed or, like,
Correct.
followed or whatever?
Right. He didn't want to do this profile. He didn't want to be part of this effort of this author to write a profile about him. Um, and the author, is able to convince him, obviously, to go ahead with it. I mentioned that because it seems to me, in my most favorable reading of the situation, that the author was heavily influenced by RFK Jr.'s concerns about this article. Um, Either that, or, well, I should also mention that this particular author is not a science writer, and that is very clear. It is
I'm
very
sorry.
clear when
I'm
you read
sorry.
art.
Like, hang on, hang on. I just wanna clarify. So, The Atlantic
Mhm, mhm,
decided that they would do a profile on someone who what was the word that you said they said that he was not influential. What was it? Important?
I think that they said he was the most important, but let me just pull it up and
So
then we'll know for
so
sure.
so they said, "You know what? We're going to have you write a piece on the most important person in science." And they thought, "You know what we're going to do? Let's send someone who doesn't know a lot about science."
Powerful. Sorry, powerful.
Oh,
The most
powerful. Well,
powerful,
he is
which
the
is
most
fair. He does
powerful
have power.
person. But again, the most powerful person in science, we should send someone who doesn't know a lot about science. And no shade, maybe this reporter, took some science classes, but like, I don't know. I mean, it feels like I'm just guessing. If I was RFK and I was intimidated by the idea that, somebody who knew what they were talking about was going to talk to me and follow me around and listen to all the nonsense I say, I can imagine how he would not agree to somebody who actually knew a lot about science.
Right. I I don't see anywhere on this person's page that they are a science reporter, and I can say from what I read that they don't write like someone who knows about science. And so that's, I think, already problematic. And so it's hard for me to tell whether there's a lot of, let me back up and say that there's a lot that I think is inappropriately written in this article.
Mm.
And it's hard for me to tell whether it's because the author was influenced by RFK Jr.'s desire to not have a negative profile of him, or if it's just that the author really has less of an understanding of these issues and so goes along with what RFK Jr. says because he doesn't know better. And I'm not trying to be mean or anything to this reporter, but this is a really important issue for public health and perceptions of the credibility of RFK Jr. in the space of science and public health and health. And this article was an opportunity, I think, to really hold a mirror up to what this man has done in the way that he's destroying and dismantling public health and science in this country. And I do not think that this article did that. And the specific things I would point to and give a few examples of where I think it fell short. So one is near the beginning, he's talking about RFK Jr. He almost seems enamored by him in some ways. He says his
I mean,
bronze face.
RFK, I mean, he's a charismatic man with good hair. It gets you far in this world.
I mean, I guess so. He does not, to me, he has not an ounce of charisma. But again,
No.
I've never been in his presence. Perhaps I would feel differently. I mean, Mother Jones also had a piece, by the way, which I haven't read, about like why women fall for RFK Jr. Different issue. I haven't
I'm
read
sorry,
it.
I'm gagging for those who cannot see. I'm gagging. It's gagging.
Anyway, this reporter or this writer says his bronze face, all chiseled angles, his eyes sky blue. He adheres to a strict uniform at work, dark embroidered skinny ties like his father sometimes wore. So shout out to a beloved figure. With suit jackets that bulge over his bodybuilder's chest and biceps. Like, is this a romance novel or is this a profile of a public figure? I'm very confused. Then he says he regularly pulls ZYN nicotine patches from his shirt pocket or desk drawers to tuck between his lower lip and gum. And here's a key point. He says, when I asked him to square his nicotine habit and the time he spends tanning with the federal health advisories against both, right? He shifted in his chair. I'm not telling people that they should do anything that I do. I just say get in shape. Okay. So that's one example of what I thought was inappropriate, right? So he's like kind of glamorizing this man. Like, this is clearly a favorable portrait in a way that this person I don't think deserves and that does not meet the moment that we are in with the largest measles outbreak we've had in 25 years, about to lose our measles elimination status as a country, with more cases of whooping cough than we've had in at least a decade, I believe. We just had a third death in Kentucky from whooping cough, but that's pertussis. Okay, so
Kids die of pertussis every year. It's terrible. It's terrible.
and it's vaccine preventable is the key point there. And then when the author does ask him, well, what about your unhealthy habits, right? Which I think is relevant too, because we've talked about, I think before, things like Dr. Oz and others, including RFK Jr., talking about personal responsibility for your health and like making healthy choices. And we have this person who himself is making very unhealthy choices. which, I mean, he has the right to make. He's an autonomous person. He can do whatever he wants. But then to sit there and judge other people for their health problems because of food choices or diet, or that's the same as food choices, but or exercise, it's pretty hypocritical. So that's one thing. Then the next thing that stood out to me was, and sorry, but I would just say before I go on to the next one, that in general, throughout the article, it really felt like there was a favorable filter being placed on everything that, again, I feel is very undeserved and does the public a disservice. So he goes on to talk about some of the things that are happening in the context that led to this moment, like going back to the early parts of the COVID pandemic. And he's talking about the public health response. And he says, even some of those who led the public health response during those years admit that COVID vaccine mandates may have been counterproductive, that social distancing lasted too long, and that masking may not have done much to limit transmission. And
Just given uncritically.
yeah, and this is the writer of the article. This is not from RFK Jr. This is the author of this piece saying these things. And we could spend a lot of time debunking a lot of things in this article, but I do want to point out that there's a ton of data on masks and their effectiveness for reducing transmission. And he just puts that in this list of things, which I think the other things he lists are also questionable assertions on his part. But that one, I mean, that is extremely clear. There have been numerous studies. And to just say that as part of this article, I found disturbing that was like in that list, and that we're supposed to take this person's perspective on RFK Jr. with regard to science seriously. He also goes on later to, again, that favorable filter that he puts on RFK Jr. He says, well, in other areas, he's pushed for changes that health activists and wellness influencers on the left, as well as many in the scientific mainstream, has long sought. Now, listen to this list. And also keep in mind, he lumped together wellness influencers and scientists, okay, which we don't generally have overlapping perspectives because we're not generally working with the same set of information. Scientists are working with facts and data and evidence, and wellness influencers generally are not. So he says, this is the author of this piece saying that RFK Jr. launched initiatives to review baby formula ingredients, issue new guidelines for fluoride use, limit student cell phone use, stop the sale of illegal flavored vapes, and remove restrictions on whole milk sales at schools. And he persuaded governors in 12 states to ban the use of food stamps to buy sugary sodas. Now, again, keep in mind, he's suggesting that both wellness influencers and scientists, two very different groups, are in favor of all of these things. The guidelines for fluoride was just like thrown in there, and the scientific consensus is very much that we should have fluoride in water, which is not what RFK Jr. is advocating for. So to throw that in there felt very either, again, misinformed or disingenuous. I'm not sure. And the last piece about convincing governors to disallow the use of food stamps for sugary sodas goes back to an earlier point we made in our episode about SNAP, that it's really nobody's business what people are using their government assistance for. It is no one's place to judge. And especially someone who's sitting there using nicotine is saying people can't have sodas, you know? So I was very bothered again by that list and the suggestion that scientists all think this is good. What I think a lot of us would agree is that it would be helpful if more people had access to healthy food.
Absolutely.
I think we agree with that, right? So it would be great to have fewer food deserts, for example. That's something we could get behind, right? I think a lot of the scientific community and a lot of the public health community would get behind that. But this list of things, now I don't know specifically what he was referring to about baby formula. Maybe there was something very reasonable there. I'm not sure. And I'm not saying this whole list was bad or wrong, but it just stood out to me that these are not things that that many scientists I know agree with RFK Jr. on, or not necessarily the whole list anyway. And that's kind of how it was being painted in this article. Which again, like if you don't know, like I only know this because I'm in this space, right?
And I think that's the other aspect too, right? Is that in terms of, where do we get our expertise from? What is the role of expertise in recommendations? And what counts for consensus? And what does consensus mean? And that's the other thing. I think the term consensus gets thrown around a lot
Mm.
without necessarily thinking through, like, well, consensus of who? consensus of what groups? Consensus of groups with what expertise and based on what evidence? And so I think that I agree with you. It is very interesting to hear that specific list rattled off. It's not a list I would have put together.
Yeah, I agree. And I think back to this, my impression that this author gave a more than necessary favorable review here includes a section where the author is talking about how RFK Jr. really is interested in science and has some kind of insatiable hunger for learning more. And he quotes, or he repeats, I should say, what RFK Jr. has told him, which is that he read 70 scientific articles over a weekend around the time that they were making those, non-scientific claims about Tylenol and autism. And the author of this article just says it as though that is true. And
Well, also, it doesn't matter if it's true. I mean, and you know this. I mean, there's such a huge portion of medical education and of that was extended into my residency education has been a big part of my career, which is that you actually have to understand how to recognize a bad article.
Mhm.
And that is not like there are a lot of things that are published. For example, when we think about the origins of the modern anti-vaccine movement, right? Like Wakefield's study
Yeah.
being published in the Lancet and not being retracted for a very long time. And so, you have to be able to learn. You can't just read everything and assume that every single article that you read is accurate, is scientifically sound, is not a subject of undue influence from certain industries that may have a stake in the outcome or what is presented as the data. And so, like, even if he did read 70 articles, who cares? Like, I could read 70 articles. I should be able to also recognize what are the scientific problems with any of those articles. What are the claims that are made that just don't pass the smell test? How did those researchers get to that conclusion? And is that conclusion enough to actually change my practice? And the reality is that, like, I don't believe that RFK is capable of doing that. What I will say, yet again, and we have said this on the show, RFK, do you want to come to med school? Because I think that you could really benefit from a better education. And I think there's time. You could go to med school. I think that might be helpful.
I mean, honestly, even if you got an MPH, I think that would be helpful. That would be a step in the right direction. But the thing is, yes, I agree with you that the number itself is not necessarily super meaningful. But again, thinking about people who are not in science who read this article, to them, that's going to sound like, oh, he's a very serious man and he takes this responsibility very seriously because he's reading 70 articles. And I would bet my house that he did not read 70 articles. He may have read 70 abstracts, maybe read 70 summaries, maybe even ChatGPT summaries of 70 articles. I don't know,
Well, we
but
know his group used ChatGPT to write their reports sometimes. So,
correct. So I do not believe that he read that number, and it gives him an air of seriousness that I don't think is deserved. And to your point about the interpretation of these studies, so there's a couple different places in the article where the author shares what RFK Jr. says about a study and then shares that experts don't interpret it that way. And here's what experts have said about it. And one other thing that I was disappointed in this article is that he presents that as a false equivalency. Like RFK Jr. says this, experts say this, let's move on. Not RFK Jr. says this, experts say this, RFK Jr. is wrong yet again. And one example of this is a study that I don't think we've talked about on here is a Swedish study that came out earlier this year looking at the amount of aluminum in vaccines to
mm-hmm.
to look at how that relates to development of neurodevelopmental disorders, including
Mm-hmm.
autism.
Mm-hmm.
And the conclusion of the study was that really it doesn't. There was no difference in the rates of various neurodevelopmental disorders based on the amount of aluminum exposure from vaccines that these patients had. And at the time the study came out, RFK Jr. had this long explanation on Twitter about what was wrong with that conclusion. And he asked for the study to be retracted altogether from the Annals of Internal Medicine. And he fixated on a specific figure in the supplement, which was one of numerous comparisons And it looked like that one was slightly statistically significant for like a 1% increase in this one thing for autism, right? And that was his big diatribe, that actually what the study showed was that aluminum does cause autism. That was what he argued. And the authors and other people have done very clear and elegant um, responses explaining why that is not the appropriate conclusion to draw from the data. And you and I both know that when you do a large number of comparisons, you have to correct for the fact that you're doing a large number of comparisons. And then something that looked like it may have been statistically significant may no longer be statistically significant. But again, he doesn't understand this because he doesn't have, as you said, the requisite education and expertise to understand these data. And in this Atlantic article, I really did not appreciate that the author did not make that clear. If you did not know going into the article what the reality is, you might have come away thinking that, oh, it's just like a difference of opinion. Like he interprets it this way, they interpret it that way, everything's fine. And that is not at all true. Like how he, as someone who is not educated in this field, interprets a study versus how an expert interprets a study, these are apples and oranges. And it is insulting to the scientists who do this work to give so much weight to his impressions without giving any context. By the way, this article does not talk about what happened in American Samoa, where RFK Jr. convinced them to stop doing measles vaccinations that led to a lot of people, mostly children, dying. There is zero mention of that in this article.
Yeah, and they don't even try to talk to him about it. I mean, he constantly is saying that he's, unfairly maligned in that, but it's like the evidence is pretty significant.
Yeah.
If
And
we care about things like evidence, I mean, I don't know.
well, right. And so the author does say, that's a good point. The author does ask him, well, what if you're wrong about vaccines and people die because you're discouraging people from getting vaccines? And like 10, 15 years from now, we find this out. And he says something like, I don't have that one screenshotted, so I can't give you the exact verbiage, but he says something like, if someone could show me the evidence that I am wrong, I would adjust my position. And that is
But
so
he
not true.
doesn't. He
Exactly.
doesn't. The evidence has been shown to him again and again and again, and he insists on these outrageous claims that are not supported by evidence. The studies get done. The number of studies that have been done in this country specifically to try to undo the nonsense whims of fantasy that this gentleman has put out into the ether and helped to fund with all of his nonsense lawsuits. I mean, it's not true. He's not willing to change his mind because he is not willing to actually consider actual evidence.
Again, that's exactly right. And it was so frustrating to me because this is known. Like, this article portrays him as a vaccine skeptic when you and I both know that he is fervently anti-vaccine.
Well, and this is something that's really interesting too. So when I've talked with acquaintances and friends who have these like vaccine skepticism to anti-vaccine sort of ideas, it is so fascinating to me where they're like, no, he's not. He's not anti-vax. He's not anti-vax. He says vaccines are okay sometimes. And I was like, but like, not really. I mean, even when he said during the height of the initial measles outbreak, I mean, it was barely, I mean, to call it an endorsement is, I think, really an overstatement of what he said and the tone that he used. And as somebody who, I'm as an anesthesiologist, as a pediatric anesthesiologist, we are, part of my role at the beginning of a surgery is to, have a patient go to sleep and then to take a special device and put a literal breathing tube into people's airways. And so, for example, during COVID, much like with, people who are working in ICUs like you did during COVID, it's an incredible amount of exposure when you're really thinking about like I'm in someone's airway. If I have somebody who's sick with we take care of a lot of kids, they have RSV, they have pneumonia, they have the flu, and they also have a surgical emergency. So I just think so much about how many kids are going to develop these conditions that are absolutely preventable and how many more children are going to be exposed, and how many other children, even who are vaccinated, we're going to start to see more breakthrough infections because we're going to have more exposure for people. And so the people who are going to pay the price are going to be children. Some children are going to die from these conditions. Some children are going to have permanent disabilities from these. They're going to have long-term respiratory illnesses. They're going to have other complications. They're going to have encephalopathy from things like measles. There's so many complications that are going to come, and these are going to happen long after RFK is out of this position. And it is so upsetting to be able to see the writing on the wall. Recently, I had to take care of someone who had been exposed to a vaccine preventable illness that I have not seen in my practice. It has been suppressed for all this
Mhm.
time very effectively. And so to see some of these conditions, it breaks my heart. It breaks my heart. And these families are having to navigate these. We got to put all it's just terrible. It's so terrible. It is unacceptable and it is unforgivable. The behavior that he has been allowed to put at the highest levels of our public health infrastructure. I am profoundly alarmed that we will never quite come back from this.
And I mean, if we do, it will be generations. It will be generations because of not just this public health aspect of what we're talking about, but all the grants that have been terminated, the scientists whose work has been severely negatively affected, all the mRNA research that was terminated despite promising data using those mRNA vaccines for the treatment of cancer. Um, Out of nowhere. I mean, just to be clear, we all have mRNA in our bodies. That's a part of how our cells function is they use mRNA to turn, anyway, whatever. That's part of our basic cellular functions. We all have mRNA. It's part
Love a
of,
messenger. Don't shoot the messenger.
yeah, M stands for messenger RNA for anyone who doesn't know. Um,
Wah, wah.
for any of our listeners who are part of the COVID conscious community, I think just to be clear, you and I both understand that we still are in a COVID pandemic. Just some people get triggered with the phrase during COVID. We both understand that we are
Yeah.
still during
We're
COVID.
both masking still.
We're both wearing masks. Yeah. And so I just want to point that out in case anyone listening is like upset.
I just bought all new air filters. Like,
Yep. 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 We are both very, very concerned and conscious,
yeah,
concerned, whatever
conscious.
about about COVID. So that was a lot on that article, but what you were just saying about how many children will be harmed and how many people with who are immunocompromised, keep in mind for our audience, like there are a lot of there's a big window of susceptibility for newborns before they get certain vaccines, right? Not everything is given right at birth. And so not all children, even if they are going to be vaccinated on the vaccine schedule, would have immunity just yet. Depending on which condition you're looking at, these are at different times, right, within the first few years of life. And it's just a vast number of people. And you don't know by looking at someone if they have a condition that puts them at increased risk for getting sick from one of these things, like if their immune system was able to mount an appropriate response after they were vaccinated, or if they're on medications that suppress their immune system. You just have no way of knowing when you look at a person what the function of their immune system is. And so that's why, it's part of why you and I both try to be safe and protect ourselves and those around us. Um, so I want to connect that article because that came out this past weekend, but another
Okay.
article came out. So that was in the Atlantic. I want to connect this conversation about this Atlantic article with another article that came out over the weekend in the New Yorker. It's written by RFK Jr.'s cousin, Tatjana Schlossberg, and it's called A Battle with My Blood. The story, I would really recommend that people read this article, whatever you think about whatever we just said. It's a very well written article about the end of life and
Mm.
facing our own mortality. The basic story that's not the reason I'm mentioning it is that she unfortunately found out when she was delivering her second child that she has a form of AML that is pretty resistant to treatment.
Mm.
And she goes from delivering her baby to pretty immediately going into figuring out what the treatment needs to be and starting treatment. For medical folks, her white blood cell count was about 130,000 at the time of delivery. That's very high
That's
for.
bad. That's
Mhm.
bad, folks.
Yeah, normal is, depending on the lab, somewhere in between 5 and 12,000 ish. So she's over 10 times higher than that. So she it's very well written, it's very compelling, it's very sad, because she describes everything that she's gone through since that delivery, the various rounds of treatments, the different kinds of treatments that she's had, how little time she's been able to spend with her baby.
Sure.
Um, and because she's been in the hospital so much of the time since then. And also what it means to have her life be ending so soon. She's in her 30s. She's young.
Yeah.
Well, I think it's a piece that's very compelling on its own. Again, would recommend folks read it. And in this article, there are a few different times when she references her own cousin's efforts to undermine people like her accessing treatments like that the ones that she was able to get. So she says that during a time when she was receiving CAR T treatment, which is it's a much newer treatment. She says, a method developed over many decades with millions of dollars of government funding. My cousin, Robert F. Kennedy Jr., was in the process of being nominated and confirmed as the Secretary of Health and Human Services. Throughout my treatment, he had been on the national stage. Previously a Democrat, he was running for president as an independent, but mostly as an embarrassment to me and the rest of my immediate family. I
That's a
mean,
sick burn. That's a sick burn. I just, wanted to bring it up.
I, I was like, don't hold back. Like, tell us how you really feel. I think that's really remarkable because she obviously she's just been going through a lot for a long time. She's physically ill, facing the end of her life, and she's using this opportunity to call out her own family member is doing. And she goes on to talk about how her mother, Caroline Kennedy, had sent a letter to the Senate prior to RFK Jr.'s confirmation, hoping to prevent his confirmation. Um, and then she talks about what was happening with the healthcare system. She says, suddenly the healthcare system on which I relied felt strained and shaky. Doctors and scientists at Columbia, including her husband, didn't know if they would be able to continue their research or even have jobs. She's referring to all the changes that happened in the spring as they were holding federal funds over the head of these universities, and also specifically revoking federal grants. Um, and she talks about not knowing if she had to change insurance, whether she would be able to get coverage now that she had this pre-existing condition. And she was concerned that she wouldn't be able to get vaccines again after she had treatments that were wiping out her immune system. So if she were to survive, that she would have needed new vaccines and was concerned about whether she'd be able to get them because of her own cousin. Um, and she goes on to talk about this for a while. And then she says, I watched as Bobby cut nearly $500 million for research into mRNA vaccines, technology that could be used against certain cancers, and slashed billions in funding from the National Institutes of Health, the world's largest sponsor of medical research, and threatened to oust the panel of medical experts charged with recommending preventive cancer screenings. I worried about funding for leukemia and bone marrow research at Memorial Sloan Kettering, which is one of the hospitals she went to. I worried about the trials that were my only shot at remission. Early in my illness, when I had a postpartum hemorrhage, I was given a dose of misoprostol to help stop the bleeding. This drug is part of medication abortion, which, at Bobby's urging, is currently under review by the Food and Drug Administration. So, anyway,
God, how much of a betrayal must it be? I mean, the entire American people are being betrayed by this person's actions, but like to be in that family and to be going through what she's going through and be so directly influenced by someone that like I'm sure she like had to sit through, Thanksgiving dinner with. Um Gosh, that's brutal.
it's brutal. And she is very aware about this outside of herself. I just want to be clear for folks who haven't read the piece. This is not a self centered, woe is me piece. She really writes about this broadly about who else is being affected, whose trials for whatever condition were interrupted or ended because of her own cousin. In that part that I was just reading you, she goes on to say, I freeze when I think about what would have happened if the misoprostol had not been immediately available to me and to millions of other women who need it to save their lives or to get the care they deserve. Um, anyway, I think I wanted to mention that because she, first of all, is an excellent, incredible writer. And to use this opportunity to not only share about her experience, which is moving, and I think probably very insightful for a lot of people, she's also using it to say, my own family member is causing a lot of harm, and that's part of my experience too, and it's affecting a lot of other people. So I thought it was very powerful. And to see that she is able to write about him more clear-headedly and more clearly than an
Mhm.
Atlantic writer who really should have no allegiance to him,
Mm.
right? It was very striking to me. And it points to such a failure of our media that have let us down time and time again with these false equivalencies, thinking that that is journalism, when in fact, when the house is
Both
burning,
sidesism.
yeah, when a house is burning, you don't have a responsibility to represent the side that says, no, it's not burning. That's not what journalism is. I mean, I know
To
that I'm not a
represent the
journalist.
side who lit it on fire, to represent the arsonist.
Right. Like
Oh,
I
brutal.
am just baffled at how in this moment in time in particular, again with the measles and the whooping cough and all the things that are happening, a journalist, a writer, reporter, I don't know how he can self-identifies, but a person writing for the Atlantic would choose this as the way that he's going to write about this man. And at the end of the article in the Atlantic, RFK Jr. compares himself to Rachel Carson. Rachel Carson, for people who don't know, is a woman who identified that DDT was toxic and DDT was used on a lot of plants. And
I'm sorry.
yeah, hmm yeah, for real. That's what he says. I'll tell you exactly what he says. I have the screenshot. He says, oh, a few months earlier at a White House event, RFK Jr. compared Trump to President Kennedy, who had worked with the biologist Rachel Carson in the early 1960s to reduce the use of pesticides. My uncle tried to do this, but he was killed and it never got done, Kennedy said. And ever since then, we've been waiting for a president who would stand up and speak on behalf of the health of the American people. Says the man who is actively harming the health of the American people. And in the meantime, since we're talking about pesticides, a couple other things that happened recently are the EPA, so Trump's EPA, has approved the use of two different pesticides that scientists say are part of these forever chemicals, or the PFAS or PFAS or whatever people want to call them. They're isocycloseram and cyclobutyrfluoram. That's in the last 2 weeks. They've approved the use of both of these, which these so-called forever chemicals have been associated with worsening fertility, high blood pressure during pregnancy, cancer, developmental delays, high cholesterol, and a host of other negative health outcomes. And so we're supposed to believe that this administration is working to make Americans healthy again, that Trump is like Kennedy, and that RFK Jr. is like Rachel Carson when they're approving these forever chemicals to be used on food that we ingest. Also, the EPA has now decided to try to undo one of the Biden regulations that was requiring a decrease in what's called particulate or particle pollution. So particles down to the size of like 9 microns instead of 12, which is what the breaking point was for under the Obama administration. So they want to reverse that because it's too expensive to get rid of all the particles that are bigger than 9 microns instead of 12 microns.
I mean,
And
but
that
honestly, but Argavon, like, how are rich people supposed to get richer if you're gonna make them do things that are harder?
I know, but how are we going to pretend we're going to try to make America healthy again while we are increasing
But this
pollution?
is this is the scam, right? And this is one of the things that makes me so sad about the Maha movement is that it's now I never thought that Kennedy would be successful in his run for president. I never thought that he would be successful. I think he was fringe, whatever at the time. He But I was very curious about this, like, make America healthy again idea. And it's so unfortunate that it is driven by so many wellness influencers who are in alignment with the nonsense that RFK spouts, because the idea that we could actually have a government that was united in improving our health and improving our access to clean food, improving our access to reliable healthcare, those are all things that I can get behind. And those are
Mhm.
all things that, in the practice of medicine, I am desperate for our kids to have access to clean food, for families to be able to afford the kinds of healthy food that he claims he wants people to have access to, for people to not have to worry that when they go to the hospital, they're not going to get the care they need, or that it's going to bankrupt them, which is
Mhm.
what the experience is of many people in this country. And so it's such a sad, sad loss that the legacy of this Maha movement will be that it was a scam.
Mhm.
It's all a scam. And it's so sad that so many people have been so easily wrangled into this farce.
And they still are. That's the part that I have a harder time wrapping my head around. Like, I can understand hearing "Make America Healthy Again" and being like, "Yeah, that sounds good. I would like that." I can understand hearing things like, "We wanna make our food supplies healthier." Great. I can get behind that. Like, I can understand why people would wanna get behind a movement that they think is about making healthy food more available to folks and helping people
Absolutely.
actually get healthier. Like, I totally understand that. And from the beginning, it's been led by a person who is against one
Uh,
of the most important interventions to help us be healthy, which are childhood vaccines. So I think it was clear to a lot of us that this wasn't going to actually make America healthy, but it could have
Absolutely.
made this movement and this man and his leadership, if we want to call it that, could have made some positive changes, even alongside the harm that he's causing. But that hasn't really been what's happened. It's really been all harm, no upside, along with what I said about the PFAS or PFAS and the pollution. The other thing that's happened recently is that the administration now wants to withdraw a proposal that had been put in place to test talc products for asbestos, which is known to be in some talc products. And that was what the Biden administration put forth, that these products should be tested. Talc is used a lot in cosmetics. And this administration says, no, actually, we don't need to do that. We want to make mesothelioma great again, or something like that.
mesothelioma.
You have to laugh because it's just so absurd. But anyway, so these things are not consistent, right? What he can sit there and say all he wants, that his goal is for Americans to be healthy, and then he takes all these actions and makes these policies that are directly going to make America unhealthy, including, I hadn't mentioned earlier, what it meant to mention is we now have a new CDC deputy director.
I was about to say, I mean, a new clown has emerged from the clown car of public health.
It's just never ending, right? There's always one more. That's the whole point of the clown car.
I was going to say, so we've mentioned before on the show that the person who's the acting deputy director of the CDC is Peter Thiel's friend Jim O'Neill, I like to think of him as a libertarian goon. He's somebody who thinks you should be able to like sell your organs to make money. And so now this
What's
person,
your excuse for being poor and you still have two kidneys?
yeah, why are you poor when you could sell a kidney? What could possibly go wrong? Now, he's literally said things, and we're talking about Jim O'Neill here, has literally said things like, yeah, don't you want to be able to take that nice vacation after dad dies? I'm like, what the fuck are we, what? Who are these people? They have too much money and too little sense. Too little
I know
sense.
they don't have real world problems. That's the issue, right? They don't actually have the problems that most of us have of like, how am I going to pay my bills? How am I going to feed myself and my family? And so they start inventing all sorts of problems that we don't actually have and trying to find solutions for problems that most of us are not facing.
Unethical solutions to those problems. Well,
Correct.
so the replacement is Ralph Lee Abraham, who you're going to be totally shocked to find out history of being kind of opposed to vaccines. Turns out not down with a bunch. I know you're surprised. I know
So
you're
shocking.
surprised. Oh, so on November 23rd, he was I guess listed internally to be this principal deputy director, which basically makes him like the number 2 leader because of course, we don't have an actual director of the CDC right now.
Because Susan Menarez was pushed out.
Correct. I mean, for it sounds like, trying to do the right thing and not allowing some of this nonsense to happen. Anyway, so this guy, he used to be the Surgeon General of Louisiana's Department of Public Health, and then he was a U.S. representative for a while, up until 2021. And get this, okay? I mean, again, you're not going to be surprised, but you will probably still be horrified. So he ordered the Louisiana Health Department to stop promoting mass vaccine campaigns, literally including during an influenza rise.
Well, that's what I was gonna say. I think it was in February, right? Which was like this past year was one of our worst flu seasons in a really long time. And in the middle
Hmm.
of all that, he's like, you know what? Let's stop. We need to stop promoting vaccination.
Yeah. Yeah. He thought that was a good idea. I'd have to look up exactly how many kids in Louisiana died from the flu, but the number of pediatric deaths from last year's flu outbreak was quite high. It's never zero, unfortunately, but it was pretty darn high, and it was really sad.
Yep.
He also said that COVID-19 vaccines were dangerous.
Hmm.
He pushed a bunch of unproven COVID treatments, including hydroxychloroquine and ivermectin, and did a bunch of, like, media stuff where he talked about being very skeptical of a bunch of, COVID therapeutics that actually had some evidence.
Hmm.
He delayed notification of a
Hmm.
pertussis outbreak. So we were just talking earlier about whooping cough and pertussis, and he said, "Oh no, we should not tell people about that right away."
Yeah,
Like, that's bananas.
I believe they had 2 deaths from whooping cough, and that was
Mm.
more than they'd had in 35 years. And he delayed notifying people for who knows what reason for a disease that is vaccine preventable.
So sad. It is so sad. We're run by this clown car of fools. They are just making us sick. He said that a bunch of public health interventions during the height of the COVID pandemic were tyrannical and coercive.
Ah, yes, of course, of course. How dare public health officials want us to protect ourselves and each other? What tyrants they are. Um, the other thing is the one thing about the ivermectin that you mentioned that he was
Mm,
a proponent of that. So he was one of the highest prescribers of ivermectin in the state of Louisiana. So he's really like going for it.
so embarrassing.
Yeah,
So
all
embarrassing.
star performance from him. So yeah, so this is the guy who is basically kind of the highest ranking person now at the CDC. Um, and I want to point out something because we're talking about the CDC. Another thing in that Atlantic article was that RFK Jr. says in that article that scientists won't debate him, and he actually says that people in the CDC would not come talk to him about vaccines. Whereas some of those people who resigned around the time that Susan Monarez had resigned explicitly posted publicly that they had tried multiple times to talk to RFK Jr. about vaccines and that he refused to talk to them. But was that in this Atlantic article? No, no, you're right. It was not. It was not. It
It's so
was.
weird what counts for reporting, though.
I
Like,
know. You just say what the guy said to you, and that's all you have to do, really.
is the Atlantic hard up for fact checkers? Like, I did nobody.
I mean, I
It's
honestly don't
weird.
know. The whole article, as I was reading, I was like, but there's so much more to this. Why are you only presenting this or acting like this side of it is the full truth? I don't know. But yeah, to that point though, just for our listeners, many people have tried to tell RFK Jr. what the data actually show about things like vaccines, and he does not want to hear it. But in his mind, the narrative is that people won't talk to him, and so that's the real problem. But that's not true. Many people have talked
Maybe
to.
the issue is that he. Maybe the issue is not that they won't talk to him, but that he won't listen.
No. You mean like maybe he has
I'm
entrenched
just saying
views?
it's possible.
You're saying he has
It's
entrenched views
possible.
that are recalcitrant to facts and evidence and data?
Maybe. I mean, I'm just saying it's possible.
I agree. I
It's
think it's not just
possible.
possible, I think it's probable. I mean, I think that's exactly what's happening. Um, Either
Well,
way.
and and the thing is that and again, we talk about false equivalences, and like you and I have talked before, like obviously there are, um, physicians and scientists who have spoken with perhaps too much um, certainty
Hmm.
or
Hmm.
been not loud enough in sticking with their I don't knows or I'm not sures or we don't have enough evidence. But I do think that there is an incredible false equivalence that also happens there where it's this, oh, well, those doctors told us that we needed to do things that it turned out we didn't need to do or we don't agree with what. And I think that there's such a difference of we have to change the way that we respond over time as new evidence emerges
Hmm.
and how challenging the earliest parts of the pandemic in particular were because we didn't know. I mean, that's why there were genuine, legitimate studies of ivermectin
Yep.
because how freaking cool would it have been if that worked? If
Yeah.
that had, I mean, people
Or
would have celebrated.
hydroxychloroquine.
And so, absolutely. Absolutely. And so it's incredibly frustrating, the multiple false equivalences are made and how hard it is to undo false information.
Right. Once it's out there, it's very hard to roll it back in.
Yeah. And so this new guy, Ralph Lee Abraham, like I'll be honest with you, my hopes are not high.
My hopes are not high either, and I do wanna share what, the last person who had that role at the CDC said about Ralph Abraham, which I came across, in an article earlier today that I was reading just to try to understand a little bit more about who this person is who's going to have great influence over our public health. And this person, Dr. Nirav Shah, is the predecessor at the CDC, and, Dr. Shah said Dr. Abraham's prior job performance and his prior judgment calls are disqualifying as it relates to being the principal deputy director of the United States CDC on a number, of the US CDC on a number of critical and pivotal issues in public health. He doesn't have a good grasp of understanding scientific data, as evidenced by the fact that he embraced the use of ivermectin as a treatment for COVID. He has labeled the COVID-19 vaccines as dangerous. All of that tells me he is unable to grasp and process scientific and medical data. That, my friends, is the deputy director of the CDC. Fantastic.
Also, interesting, he is not a board certified family medicine physician.
Correct.
There have
Well,
been claims, but he is absolutely not. I mean, I have yet to find any evidence that he is board certified. There was a certified letter that was sent. New Orleans Public Radio had sent him a letter trying to investigate, like, are you board certified? And his response was, not once have I ever claimed to be board certified by the American Board of Family Medicine. Um, so there you have it, folks. That was in February 2025.
yeah, he has a medical license, to be clear for folks. He does have a medical license, but he, yeah, is not board certified. He also, interestingly, was a veterinarian. I think that's kind of cool. I don't know. You don't hear too many people who are veterinarians and then go to medical school. But anyway,
That was actually my dream was to attend, but there are a few programs where you can learn to be both a veterinarian and a physician. And I wanted to be able to like live out in the country and like be a large animal veterinarian and a human animal veterinarian.
you know what? It's not too late. It's never too late to live your dream.
It's too late for that dream.
It's not. We can all move. You can treat the animals. I will. I don't know. I'll run the farm. I don't know. Can't there be a farm wherever we? And then maybe you just treat the animals on the farm. I feel like this is some kind of like rom com from the '90s taking place here.
We can come up with our own next version of All Creatures Great and Small.
Is that? I don't know what that is.
All Creatures Great and Small was a book series that was written by a veterinarian. He used a pen name to write these stories, and he wrote about his life as a veterinarian in, I believe, like rural England.
Hmm.
And so it's a lot of stories of like fictionalized accounts of his patients and dogs he took care of, and cats he took care of, and animals he helped to rescue. And anyway, I loved those books when I was a little kid.
I somehow missed those. What about a ranch in? Okay, this is a little far afield. Why don't we just get a ranch down in Santa Barbara?
Oh, yeah. I mean, I'm sure that we can both just afford to buy a ranch in Santa Barbara, but sure, I would do it. I would do it.
There you go, bringing money
I
back
did
into the equation.
I know. I'm sorry. I should allow us to live in the fantasy. Now, I did work at a ranch in my 20s. I worked at a ranch that was owned by the Boy Scouts of America, and I helped feed the horses every day and got to hang out with a bunch of you know, burros. It was great.
Well, you have actual relevant experience, of which I really have none, but I'm willing to learn.
We're going to have fun, and we'll be in Santa Barbara, so it's fine.
So
Uh,
I think we have spent probably too much time talking about people who don't deserve a lot of our attention, except for the fact that they're in positions of power, unfortunately, over us. So with that, what is bringing you joy this week?
I have been watching this show on Apple TV called Pluribus, like E
Pluribus,
Pluribus Union, like
pluribus.
Pluribus. See, I don't speak Latin. Pluribus, and I will tell you, when I saw the preview for it, I wasn't sure if it would be for me, but I am really digging it. I am loving the lack of clarity of like, is this, and I don't want to make spoilers for people, but it's basically about a woman who an unusual event happens that impacts almost every human in the world. She is one of 12 people who are not impacted. And so you are trying to learn about what has happened and like, is it good or is it bad? And it's fascinating.
I agree. I've been watching it. No, I've been watching it and I 100%
Ooh.
agree. I like they put out the first two episodes together and I was like, "Where's episode 3?"
Mhm.
And so it's so good cuz you just want to know like what is happening in this version of our world. So yeah, +1 that recommendation. What has been bringing me joy is in the last like week or so is there's a trend on Twitter that was started by a woman who did the unconscionable thing of getting a doctoral degree, and she posted it on the internet. Well, I guess that was the unconscionable part, was that she posted about her degree on the internet. And so certain kinds of people got very riled up about it. So this woman's name is Juliet Turner, and she posted like a perfectly normal, I just want to be clear, perfectly normal and appropriate post. She said, "I passed my Viva exam after 4 years of research. I successfully defended my thesis. You can call me doctor." And there's just a picture of her standing in front of
And
presumably
this
one of
is
her.
recent. This is recent.
Yeah. This is not Allie Lukes, who you might be thinking of. That was maybe like a year-ish ago that the same thing happened. Very similar.
But
Uh,
again, I mean, I think it's funny in the context of like you and I keep talking about these jackasses with podcasts who are like, women belong in the home doing what they're naturally supposed to do.
Right. So she posted this, and then she got a lot of nasty responses that she posted to share. And what ended up happening was this guy, I think Richard Cooper is his name, if I find it here. He said, "Just look at the degree on that chick," said no man ever. That was what his post was. He like quote tweeted her post about her defense, as though, right, the implication is that she thought, or that any woman who gets a degree thinks that they're doing it like to get men, or that men are in any way involved in our decisions about like what we're going to do with our careers or what we're
He
going to say.
sounds he sounds like a snowflake.
He sounds very ill-adjusted to the reality of the modern world. So what happened though after, so that part obviously is not bringing me joy, but what happened after is what is bringing me joy, which is that lots and lots of women from all over the world started posting, "Just look at the degree on that chick." And then pictures of themselves either in their regalia or with their degrees. And that has been just all over my feed for the last like week. Every time I scroll, I see a new woman has joined the trend and has another beautiful picture with her degrees or at her university or whatever. And I'm loving it.
That's amazing. You know what that reminds me of is when there was that distractingly sexy science, or I forget exactly what the hashtag was, but there was some, this is a number of years ago, it was also on Twitter, and there was a like senior scientist who was like, I don't like women in my laboratory because they're just distracting,
Mm.
in the way that they behave and the way they look or whatever. And so it was all, there was this huge trend of like women scientists showing themselves like in all of their laboratory gear, like their hazmat suits, in their white coats, pipetting things. And it all said like, I think distractingly sexy or something like that. It was really fun.
Well, I should go find that. I don't remember that. I probably missed it, but that sounds fantastic and very relevant. So yeah, folks can check that out if you happen to be on Twitter. Not that I'm asking anyone to be there for obvious reasons, but if you are there, just look up the phrase, just look at the degree on that chick, and I think you'll find quite a lot of lovely posts of really intelligent, educated women. So that's it for this week's episode. If you didn't like what you heard, this has been Revisionist History. If you did like what you heard, please go ahead and subscribe or follow The Present Illness. Leave us a review. Tell anyone who will listen about how much you enjoyed this podcast. We'd really appreciate it.
You can follow us on all the places. We're on TikTok and Instagram at The Present Illness to stay on top of all our TPI-related news.
And we'll be back next week with more headlines, hot takes, doom scrolling, and hopefully some more laughs.
And until then, agitate, hydrate, take a nap. We'll see you next time on The Present Illness. Don't take medical advice from random people on the internet, including your podcast. This show's for informational purposes, it's meant to be fun, and it's certainly not medical advice. So please take your medical questions to a qualified professional.